Thank you, Tina. And Dr. Strang will provide us with an update on the cases here in Nova Scotia today.
Thank you, Premier. Today we're announcing 20 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 147. Most of the cases continue to have connections to travel or a known case. Actually, 96% of our cases we know are connected to travel or a known case. As we reported yesterday, we do have one case where there are no links to travel or a previously known case, so we have concluded that this is the result of transmission within the community. We have a handful of other cases that are still under investigation to determine where they may have been exposed. To date, 4 staff and 2 residents involved in 3 long-term care facilities have now tested positive for COVID-19. I want to reassure Nova Scotians that appropriate infection prevention and control measures and support around staffing issues to provide the necessary care for residents are in place in all 3 facilities. Both residents and staff are being closely monitored, and in one facility there are one of the residents is mildly ill. All of the other residents, the other resident is still asymptomatic, and in the other 2 facilities, residents who may have been exposed continue to be monitored and continue to remain well. To date in Nova Scotia, there have been 5,763 negative test results and 147 confirmed cases. As I said yesterday, it is now more important than ever for Nova Scotians to strictly adhere to public health orders and directives. Practice good hygiene. Maintain a physical distance of 2 meters or 6 feet from others when you're outside of your home. Limit essential gatherings to no more than 5 people, and stay at home as much as possible. And I use the words essential gathering, and I mean essential gatherings. This is not a time to be getting together just because you want to. You get together with 5 or less people if it's necessary to do so. If you have to go shopping, have one person go shopping. If the simple message is stay at home as much as possible. If you are required to be in self-isolation because of travel or because you're a known contact of a case, it's critically important that you maintain that full 14-day self-isolation period. By working together, following these public health directives, this is how we're going to stop the spread of this virus. This is how we're going to get out of this as quickly as we can, being able to start to loosen the restrictions. It'll be a number of weeks, but the firmer we are and the harder we work together to follow public health directives, the sooner we'll be able to start to relax things. I want to speak to, you may have heard of 4 cases of Nova Scotia Health Authority employees, and that may create some concern, but I want to just reassure people that 3 of those cases are actually people that we're already aware of. They're involved in the long-term care facilities that we are following up. The 4th case is a new case from within the last 24 hours, but it's a person that does not provide direct clinical care. I want to move on and just talk about now, give a warning to Nova Scotians about where they may get information about how they keep themselves healthy and how to perhaps treat COVID-19. There are many people, I know this situation is causing fear and anxiousness in people, and they may be looking to online or wherever they go to information to how they can help keep themselves healthy. Unfortunately, that there are unscrupulous people out there providing misinformation around whether it's products or procedures that actually can, for instance, boost your immune system or cure you from COVID-19. This information is wrong and it is dangerous. We know that there's a lot of research underway, legitimate research that people here in Nova Scotia are involved in around looking for developing a vaccine, around looking at existing medications or creating new medications to be actually able to treat COVID-19. But if you are being approached with information, if somebody says, I have this wonderful product that is going to boost your immune system 200% and make sure you don't get sick with COVID-19, or I have this product that will cure you from COVID-19, those are that is false. Please do not listen to that information. There are unscrupulous people trying to take advantage of you. We know that while we're actively working to find a definitive treatment for COVID-19, that the treatment for this, people who are sick, is if they're able to be at home, it's like we do for other respiratory virus: rest, fluids, using Tylenol and Advil to control aches and pains. If you have to be in hospital, there's more advanced ways we provide, giving you oxygen, other ways of supportive care. It's important that if somebody is at home being treated, that we're following very strict advice around good hand washing, people providing care, putting a mask on an individual who is sick and coughing, being very thorough about cleaning surfaces. There are also scams out there that are being made aware of through email or phone calls that are offering people masks or gloves, other protective equipment. We have no idea of the quality of that equipment, whether it actually is safe and effective to use. So again, don't be taken in by these people who are preying on your concerns and your fears. We need to stay alert. We need to follow good information. We have our government website, novascotia.ca/coronavirus. That, to me, please use that as your source of truth. That is your entryway to get accurate information around coronavirus. We have lots of information in there. We update it regularly, and we have links to our federal partners in Health Canada, the Public Health Agency of Canada, so that please use that as a way to get information. If you're concerned about that you may have COVID-19, do the online assessment for 811, and you'll be directed then, if necessary, to actually call 811 and perhaps make arrangements for testing. Speaking of testing, I do want to just speak to, we have rapidly expanded our capacity within our laboratories. We expanded screening through assessment centers. All of this is producing a significant volume of work for my public health colleagues, and I want to thank them because they are making sure that everybody who has a test, whether it's negative or positive, hears back from a person. It may take 48 to 72 hours to get that result back, but please, while you're waiting for the test result, please know that you are going to hear from somebody who's going to talk to you about your results and give you direction from there. So I know it may be a bit anxiety-provoking while you're waiting, but please know that there are lots of people, and I thank them for their work, who are going to reach out to you, and you'll hear from a human voice, not a recorded message of somebody that you can talk to and ask your questions. Thank you.
Thank you, Dr. Strang. You're looking pretty dapper today. That tie is
my Bugs Bunny tie
with the stethoscope on, ready to go. You're making it tough on me. We're happy now to answer any questions that you might have.
We'll go to the phone lines now. We'll take one question and one follow-up from reporters on the phone in the time allotted that we have. We'll start with Keith Doucette from the Canadian Press. Go ahead, Keith.
Yes, good afternoon. Dr. Strang, I want to ask you a little bit more about the nursing homes, particularly the Enfield facility. You said yesterday that a mobile unit had gone there and that you were giving priority to testing there. Is there an update on further tests, and do you expect that there will be further positive tests based on what you know?
So we know that the mobile unit was brought in to support testing. My understanding, the update I got this morning, was all of the residents have been tested in that facility. The testing of staff is underway. We don't have results back on that. I'm not going to speculate what we may or may not see from that. We'll get results and we'll act as appropriate. The two residents who are positive have been isolated from the rest of the facility and are receiving appropriate care as necessary. All of the residents in the facility are being monitored carefully and having their temperatures checked twice a day.
Go ahead, Keith, if you have a follow-up.
Yeah, just Dr. Strang, how alarming is it that this has started to happen in Nova Scotia, given what we've seen in other provinces? Are you bracing for a wave in these homes in particular? Is that the point that you really want to cut off in terms of public testing and making sure that this virus doesn't go beyond where it already is?
Yeah, absolutely, Keith. We know that this is the people who are in our long-term care facility residents are the most vulnerable in our society for getting severe disease and perhaps even dying from COVID-19. We see that in other parts of Canada and the world. So we're doing what we can. That's why a couple of weeks ago we stopped visitors into long-term care facilities. As hard as that is, but we've supported long-term care facilities with iPads so they can have connection with their family members. We've stopped residents from going out into community visits, as tough as that is. We're making sure that employers in long-term care facilities are working very closely with their staff to take appropriate steps to have staff monitoring their symptoms carefully, make sure they're in self-isolation if they've recently traveled. We do have to have staff who live in communities come in and work in these facilities. The residents need care, so that it always presents some level of risk. But we have a strict, or sorry, not a strict, but a comprehensive set of guidelines that have been developed both for the long-term care facility as well as home care providers about all the ways that they need to be carefully monitoring in their facilities or their workplace, the connection of how they would then start to test and contact public health if they had concerns about an individual that may have COVID-19, and building on what we do every year in terms of public health working with long-term care facilities to deal with outbreaks of respiratory illness or influenza. We have a comprehensive outbreak plan that all long-term care facilities have, and that is the plan that we turn to in all our 3 facilities when we became aware of positive cases. So it's concerning, but I think we've done everything we could do to limit the possibility of introduction, and we have robust plans of responding like we've seen in the last few days if we get COVID-19 in long-term care facilities.
Next, we'll go to Natasha Pace from CTV. Go ahead.
Hi there. My first question would be for Dr. Strang. I'm wondering if you can update us on medical supplies and how the supply of face masks are going at this point in time.
So I was involved in a conversation this morning. I would say, that's not an area of work that I am directly involved in or deeply involved in. But the call I was on this morning to get updated along with other senior folks in the Department of Health and Wellness, we are continuing to work to understand what the needs are for our personal protective equipment across the healthcare system, making sure that the highest priority areas are getting the first attention around making sure that their supplies are met. We are involved in conversations with the federal government, who are leading a procurement process for all provinces and territories. We're also working closely the healthcare system with Nova Scotia Business Inc. and others, working with local businesses about what capacity they may have to start to produce personal protective equipment, as well as we're looking at businesses, our school system, where there may be existing supplies of personal protective equipment to bring in to be used in the healthcare system in a prioritized manner. So we have what we need to right now. There are some areas that are concerned, but we're doing everything we can to make sure that we maintain the necessary access to personal protective equipment as long as possible. This is a challenging area. There are global shortages and shortages across the country. I won't try to sugarcoat that, but everything that's been done is being done to maintain our supply of personal protective equipment to protect healthcare workers.
Go ahead if you have a follow-up, Natasha.
I do. I believe this would be for the Premier. I was just talking to a gentleman who says his son is in the EIBI program for children on the autism spectrum. They're concerned, the family's concerned, because they have not heard back to see what steps may be in place for their child or other children who are in that type of program, especially with the announcement yesterday with schools. I'm wondering if you could update us what's being done to help children in that situation.
Yeah, yesterday I announced the new e-learning program that would be taking place across the province, as well as for those that don't have internet, we'll be sending home directly workbooks that they'll be able to do work at home. But I also said yesterday, working with our partners in education, who have, and the NSTU and teachers across the province who have been a great support during this period of time. Classroom teachers will be reaching out to their students and to families to be able to put together a protocol for individual students in the coming, really this week, getting set up for when we start next week.
Next, we'll go to Shayna Luck from CBC. Go ahead, Shayna.
Hello. My first question is for Dr. Strang. Dr. Strang, you said Sunday that you were looking at geo-mapping clusters of tests. So really two parts to my question. I'm wondering, when will geo-mapping and testing within communities become a reality? And number two, I guess, really, should people be tracking their own movements in case they learn they had been in contact with a confirmed case?
So geomapping is something we're looking at. There's some issues around that we're trying to work out. We already are looking at public health. We don't need to geomap. We already, with pen and paper, we can identify where we have cases across the province. And as I've said earlier, we're looking at ways as we continue to expand our testing, if we had a community that there seemed to be something unusual activity going on, how we could potentially bring in the additional expanded testing into those communities. We're working out the kind of the final steps in that. I think it's really, it's a very good idea. Thank you for your question about people keeping track of where they may have been. Because if we identify somebody who's a case, the type of questions we're going to be asking them are exactly what you just indicated. We need to know where they have been up to 14 days prior to them getting sick, who they may have been in contact with. So as much as people can keep track of that, that's very helpful for public health to do that.
Shayna, go ahead if you have a follow-up.
Yes, I do, for the Premier. Premier, we know of at least one mall in the Halifax area that's telling its tenants it won't be deferring rent for any of them, even though some of them have been forced to close because of the pandemic. And the mall says that's because this deferral isn't available to all its tenants. It wants to be fair to all of them. I'm wondering, what do you think of that kind of reasoning? And is there anything your government can do or will do to help small business owners who are telling us that what the province is offering and what the feds are offering is not going to help them, and it won't let them survive?
Thanks very much for the question. I think it's unreasonable, quite frankly, for any landlord to not be able to provide and offer a program that has been put out unless he can offer it to everyone. There is no program that the national government or the provincial governments across this country are going to make that will be for everybody. That's why you see different programs being offered in different provinces and a myriad of programs that are being offered to different sectors. So I would strongly encourage every landlord to look at the individual circumstances of the business across the province. Why yesterday I would have announced that we changed the number of employees, that if you're a single proprietor, you can qualify for this deferral. Banks are being receptive to working with commercial landlords when it comes to deferrals on their loans. I think it's imperative that the commercial landlords take advantage of this program we're offering and provide it to its own tenants. And yes, we've heard from other Nova Scotia businesses and individuals, quite frankly, who are filing a challenge because overnight their either business was shut down or their jobs was taken, and we're putting the final touches on some additional programs. But I want to say this to the business owners out there: if you take advantage of the deferral, rent deferral, it does not mean you will not qualify for anything else that will come along. I think it's important for that, for people to understand that rent deferral was one aspect of a package that we're putting together, and we put it out when we did because we were getting near the end of the month, and we're asking all commercial landlords to be part of this solution. And to all businesses, if you're still functioning, you're still operating our economy, pay your rent, please. And then for those that have been closed down, we need to be able to work with them to make sure that they're still here and able to come out of this downturn or this closure in a strong position.
Next, we'll go to Jesse Thomas from Global. Go ahead, Jesse. All right, we'll move along. We'll come back to you, Jesse. We'll go to Cassandra Nadeau-Lamarche from Radio Canada.
Hi, good afternoon. This is for Dr. Strang. So early on, you stopped mentioning the counties where there were cases because you mentioned privacy issues. But since then, you've made public workplaces of affected people and events they may have participated in, which gives more information about their identity. And other provinces have provided a breakdown of their regions where the known cases are. Why is Nova Scotia not providing that information?
So we are going to start providing information on a daily update. We're just working through some of the I guess the technical issues of getting it up on the website, where there will be a map, the 4 health zones of Nova Scotia, and numbers of cases that are in each health zone. We wanted to, we didn't want to do that until we had at least 5 cases in each of those zones. That's a standard kind of epidemiologic principle, that you don't talk about less than 5 cases for the concerns about protecting privacy. When Public Health has made an announcement about a specific location or an event, as I've explained earlier, it's only because we have not been able to identify all the possible contacts through more confidential means, and we then have to use a public announcement to as a last resort to try to get information to the public and understand, you know, under what circumstances they may have been at risk and what actions that they should take.
Cassandra, go ahead if you have a follow-up.
Yes, so this is advice. What advice would you give for divorced couples who are co-parenting? Should children still go back and forth between parents during the pandemic, or should they just stay in one place?
So that question has come to me, and I certainly appreciate that co-parenting has lots of challenges, and COVID-19 make that more challenging. Respecting, you know, there may be legal requirements, etc. So the first thing, people would need to talk to their lawyers if necessary. But from a public health perspective, every time the child is moving back and forth, we're increasing the chance of bringing the virus between 2 homes. So if at all possible, and I know this may be difficult for families and hard to hear, but if all possible, as a public health physician, it makes sense that the child remains in one home, isolated and kept separate in that one home, rather than going back and forth between 2 different family units. Each family unit has privacy connections out in the community. You're putting that child and both those family units at increased risk of coming in contact with the virus.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Hi there. For the Premier, 2 weeks ago, you said that daycares would be compensated for lost revenue while they're closed. When is that coming?
The Department of Education is working with daycares across the province. They will remain closed, same as our public education system, to May 1st. Staff members will be paid. Fixed costs associated with daycares will be covered. But like all businesses in this province, profit lines will be impacted. Those for-profit ones will have their profit line impacted. There's no question. Just like in some cases, businesses have lost their entire profit margin, their entire revenue source. But what we will do, and what we have said, is that staff members in these facilities will continue to be paid, executive directors will continue to be paid, and fixed costs associated with these units will be covered.
Go ahead, Lindsay, if you have a follow-up.
So does that mean that there will not be any direct funding? On March 16th, you had said to one of our reporters that you would be making them whole by covering parent fees, but obviously only salaries are being covered right now. So is that now out of the question?
Well, that's not what I just said. What I said was we would be covering salaries and other fixed costs. Parents' fees cover other things other than that seat. For example, lights, electricity, heat, power, all of those things that would still be needing to be covered associated with that will be covered. But like every business that's been impacted by this, their profit line has been impacted. I have not been able to cover salaries or, quite frankly, fixed costs of every business in the province has been impacted. But we have, when it came to the early childhood education in this province, and we'll continue to make sure that the valuable employees that we have in that sector will continue to get paid and be ready, hopefully, to start up caring for our kids once the province gets back on its economic feet.
Next, we'll go to Daryl Cole from the Amherst News. Go ahead, Daryl.
Hello, Mr. Premier. A week ago, restrictions were placed on people coming into Nova Scotia at all entry points, whether by land, air, or sea, with the expectation people are self-isolate for 14 days. There are conservation orders at the entry port of Port Lawrence, but the border entry port at Tidvis Bridge has no one there to restrict traffic. The only thing there is a sign asking motorists to report to Highway 104. It appears as though New Brunswick is not allowing non-residents in, but why are we not manning border posts?
Well, thank you, Daryl. First of all, I hope things are going well in Amherst. It is obviously our connection to New Brunswick. We are manning the main border as you come across there by the Tourism Information Center. We continue to basically have an information stop to tell fellow Nova Scotians that if you are coming home, go home and self-isolate. We do have a number of people who cross that border daily for work. So whether it is our first responders, in some cases we have some people working in still some of the business that are operating in the Amherst area. They've continued to cross and then go home at night, practicing all the protocols that Dr. Strang and Public Health have put out. And of course, we still have the level of traffic coming through in commerce, goods and services that cross that border every day. And we'll continue to allow that to happen. But if there are people showing up at that border who are coming here for vacation or socializing, we're encouraging them to go home. If they choose to come to Nova Scotia, though, they have to still self-isolate for 14 days like the rest of us.
Go ahead, Daryl, if you have a follow-up.
A couple of questions for Dr. Strang. Hearing some concerns among communities along Northumberland Strait and Fundy Shore that people are coming to their cottages from other parts of Nova Scotia and potentially from other parts of Canada to escape the virus, potentially exposing rural parts of the province to COVID-19. What message would you have for those people who may be thinking of leaving the city or elsewhere in the province or elsewhere in the country to go to their cottage and ride this out?
So I think, people need to understand if they go to a more remote area, if they become sick, there may be more challenges around accessing care. Also knowing that, people in Nova Scotia, if they are able to go to a cottage that's more remote and be self-sufficient there, that they actually may be protecting themselves. But it's important that they're able to be self-sufficient in that location. But especially somebody who's got health conditions or is elderly and may be more vulnerable to severe illness, they also have to think about how they might access care if they're in a remote area. Certainly, we don't want people coming from other parts of Canada. As we've said all along, this is for Nova Scotians coming home to come and self-isolate. This is now not time to be traveling across the country, moving from one part of the country to another. So I would really discourage people that need to stay in their home community, in their home province, as we all work to ride this COVID-19 issue out together as a nation.
We'll try Jesse Thomas again from Global. Jesse, are you there?
Thank you, Tina. I'm here.
Go ahead.
Appreciate it. Thank you. This question is for the Premier. Premier, we saw a story yesterday about the Department of National Defense and in particular the Navy isolating 2 ships to get crews ready, essentially to support the fight of COVID across the country at any point. I guess I'm wondering, have you made any formal requests for military assistance at this point?
No, I have not. I have spoken to the Atlantic Command. Rear Admiral and I spoke very early on in this, wanting to identify the resources they had, not only personnel, but looking at whether or not they had equipment or hospital space in case we required isolation. But I have made no ask. I think it's important that we continue down the path of following public health and continue to make sure that we fight this in the way that we have already as Nova Scotians and continue to hold it as best we can to flatten the curve. But the Rear Admiral and quite frankly, the Atlantic Command have been outstanding partners for our province and the region. And whenever we've called, they've stepped up, whether it's been Dorian or other incidents. This one here, if we require their support, I have no doubt in my mind that they will be there.
Go ahead, Jesse, if you have a follow-up.
Thank you. And a follow-up just for the Premier again. We saw Prime Minister Trudeau today talk about the federal government issuing some contracts for manufacturing and the assistance of medical goods. And I'm wondering what the support from the province's businesses here is looking like. What do you know about businesses here in Nova Scotia who are stepping up?
So I know I heard the Prime Minister talk about Stanfield's today when in his remarks. There are a number of other companies that we've put into the national procurement model. One of the challenges, I'm sure, especially for ventilators, the specs are required in order for people to be able to make those. They're proprietary for companies, so we're trying to get those so we can provide those to Nova Scotia firms who typically don't build ventilators but have the capability of doing so. So we're continuing to work with the national government to achieve that. And as Dr. Strang said a few minutes ago, we have in this province put in an order with our sister provinces across the country to ensure that we have the supply. Fred Crooks has taken on leading that for us to ensure that we pull together all of our partners. It's just not the healthcare obviously is at the front and foremost in our mind, but it's many of our essential services in that erode in communities that will require some support to be replenished. So I was pleased to hear a Nova Scotia firm today. That was part of that, and I'm looking forward to hearing more of the firms that have offered to be part of that solution.
Next, we'll go to Sharon Montgomery from the Cape Breton Post. Go ahead, Sharon.
Oh, thank you. Good afternoon. I have a question for Dr. Strang, please. Dr. Strang, we're receiving a lot of concern over the protective gloves simply being discarded outside banks, grocery stores, sidewalks, as obviously somebody has to pick them up. Checking for ourselves, we did find them absolutely everywhere. So we're wondering your thoughts on that, and if you mind also recapping your opinion on whether the general public actually needs to wear them.
So I would say definitively no. People wearing gloves are probably less likely to be washing their hands. You still may get virus or whatever on the gloves than is taking the gloves off. So you can get a false sense of reassurance from that. So the best thing people can do is do what they need to do out in community, essential shopping, banks, grocery store, etc. Washing your hands very frequently and carefully after you've had touched. For instance, if you've been at the ATM machine or you've been grocery shopping, wash your hands very carefully afterwards. It's actually that's a better approach than wearing gloves. We also need to make sure that like masks and things, that the gloves, we have a demand on gloves we need to have in our healthcare system. So we don't want people. Not all gloves are of the right grade to be used in the healthcare system, but I would not want to see people using gloves that potentially could be used to protect healthcare workers. It doesn't really help them, and we're wasting those gloves. As for throwing them, it's like any other garbage. People just common sense, look after the community. So have some care for your community, and whatever garbage it is, dispose of it properly. Don't just throw it around.
Go ahead, Sharon, with a follow-up.
Oh, thank you very much. Dr. Strang, people do realize that the state of emergency in Nova Scotia will be in place for quite some time, but they're wondering if there is a guideline of a specific time frame needed where a case has not been identified as part of the decision to see it lifted.
We have not gotten to that detail of discussion amongst my chief medical officer of health colleagues. We know it is something that over time we are going to have to start looking at. Just like we were at the very beginning of this, we were talking together about what are the indicators and triggers that we would use to implement enhanced public health measures. Quite frankly, we're busy enough dealing with the issues we are faced with today and in the next next week or two. We will get to that point where it's appropriate. We know that we are a number of weeks out before we can even begin discussions about how we lift the public health measures, but when it's appropriate, we will be working in a coordinated way, looking at the epidemiology of the disease, looking as it evolves in our communities, looking at experience from other countries to say, what are the things you need to pay attention to, what are the signals that you can follow that will tell you when you can start to loosen off some of the public health measures.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Question for Dr. Strang, please. You said that there were 4 Nova Scotia Health Authority employees who have tested positive, and if I understood you correctly, 1 is not dealing with patients, and the other 3 are dealing with those facilities that you had mentioned before. My question is, are any of those people continuing care assistants? Because my understanding is that the CCAs typically, almost always, work in multiple locations. And is there a concern that they may be moving between homes or between institutions?
So I'm not aware of the specific kind of title that any of these individuals have. I know indeed at a high level kind of what kind of function they had, and I'm able to say whether they provide clinical care or not. Certainly we know that staff working between facilities is a concern. That we're working with our long-term care sector to try to minimize that, but we have to understand that if we held long-term care staff to only working in one facility, we're going to cause a significant issue around levels of staffing and the necessary staffing to provide care to residents. It's a challenging area, but that's why we're working together with all our continuing care partners at a collective manner to try to manage this as best as possible. But we also have to understand that we have residents that we have an absolute responsibility to make sure they get essential care.
Go ahead, Tim, with your follow-up.
Yes, to the Premier, tomorrow is the date for the rent. And I'm wondering, when you produce the small business rent deferral program, if it was costed out, do you have an estimated number of guarantees that you may be providing and a total budget that may impact into the future?
Yeah, obviously we have an estimate on what that would cost, but it will be really ultimately determined by the number of people that will require the backstop. So to be clear, the rent deferral is meant to be that the landlord would go work with their tenants to defer it over the life of that lease. That could be 5 years in some cases, so they would defer it and how they would best spread out that 3 months of what was owed. What we're doing is, for those that may be vulnerable, may not be able to recover from this, or may open for a period of time, we will cover that 3 months. So it will depend on the number of companies that actually take advantage of it. And I want to tell everyone that I expect industrial landlords, commercial landlords, to work with these small business owners. We're all frightened of what's happening. We're all feeling the pressure. There's no question about this. It will require the banks to be flexible. It will require the commercial landlords to be flexible. It will require all of our small business owners to look at how can we best, when we begin to move our economy back, spread out that cost over a period of time. What we're trying to do as a government is to provide some impetus to get that conversation started, take some of the risk out. At the same time, it's one of the number of tools that we will be providing for small businesses and, quite frankly, their employees that will have more to say in the coming days. But it is just one of those tools that will be used. Not everyone is going to use it. Not everyone will want to do that. And I think it's important for me to reiterate, for those who are working, and whether it is an individual working, please pay your rent on time. If it is a business that's still operating, please pay your rent on time. That allows everyone to be able to smooth this out for people who have been impacted at a much greater position that, because of the closures of their businesses, or they've been laid off. So it will require all of us to work together, and this is just one of the solutions that we will use.
That's all the time we have for questions. Go ahead, Premier.
Thank you, Tina. Every day we wake up waiting to hear how many new cases of COVID-19 will be announced today. Some days it's 5 or 7, and some days it's 20 like today. And it's hard. It's even harder when it hits our long-term care homes. These are our most vulnerable. Dr. Strang has mentioned, we've wrapped our arms around Magnolia and Enfield, where 2 seniors are fighting COVID in isolation and 2 staff are isolated at home. Still, other staff members come to work as they do in other long-term care homes across our province. What would we do without these workers? They are our front lines. They wake up every day knowing they are putting themselves at risk just by going to work. I want to thank them personally for caring for the residents who I am sure you've grown to know and love as family. I also want to thank the frontline workers who are out every day trying to help others while putting themselves at risk. Our doctors, our nurses, EHS, hospital staff, trying to keep our healthcare system running. Our social workers, transition house staff, our home care workers, and all those trying to assist people in need. They are following the physical distance protocols. But when you're out on the street rescuing women or children, or feeding the hungry, or providing support to the disabled community, a lot of their work is still face-to-face, and they are still showing up every day. To all those frontline workers, you have our undying gratitude, and on behalf of all Nova Scotians, I want to say thank you for the work that you have been doing on behalf of all of us.